I'm Dr. Amy Roy. I'm the Director of Cancer Services here at University Hospitals Plymouth. We'd like to tell you about a faster diagnostic process that we've put in place for patients where you suspect cancer, but they don't have the right symptoms to fit into our current 2-week wait referral pathways. We know that the GP hunch is a valuable screening tool, and that for this group of patients, about 10% of them will have an underlying malignancy. The diagnostic processes can be protracted and frustrating both for you and the patient. We hope that this new pathway will improve that and result in a better patient experience. The new pathway is called the non-site specific cancer pathway, and we hope that you will use it and find it helpful.
Hello, my name's Dr. Danny Fay. I'm clinical lead for the non-site specific cancer service. Once you've met with the patient, undertaken a careful clinical assessment and examination, including checking for regional lymphadenopathy, it's useful then to turn to the pre-referral investigations which are shown on the formulary website. After initial assessment and investigations, if that hasn't identified a more site-specific pathway, it's time then for the referral. This is completed as a 2-week wait form, similar to all the other 2-week wait forms we have available to us. And it's at this point that Gemma, the Pathway Navigator, will be available to support the patient and guide them through the process.
I'm Gemma and I'm the Patient Navigator for the Pathway. My job is to navigate the patients through the pathway until they reach diagnosis. I will ask the acute GPs to assess the referrals, and we will decide what scans find appropriate, and then I will book them. I will book the CT scans and follow-up appointments, and we aim to get the patient in within 24 to 48 hours. The patient information leaflet can be found on the Trust website and on the formulary website. It will explain to the patient the process, where they need to come, which is the AAU, and where we perform our follow-up appointments, which is the Level 2 Oncology Centre. When filling out the referral, it's really important that the patient is aware that they're on a cancer pathway and that they have all the information that they need. You can find this on the Trust website or the Devon Formulary website where our patient leaflet is.
I think that the face-to-face consultation is essential in order to get the best out of this pathway. Enables you to make a comprehensive clinical assessment of the patient, which may identify a more site-specific pathway that would suit the patient better. It also gives you the opportunity to assimilate all those verbal and non-verbal clues that make up that most sensitive tool for identifying cancer in this setting, that of gut feeling. Access to wider clinical expertise within a hospital setting is very helpful. We have input from care of the elderly physicians, as well as the general physicians and other specialties whose expertise we can access. If there is another significant and concerning diagnosis that is not cancer, we then have the opportunity to refer the patient on directly, again without having to ask primary care colleagues to see the patient and action the referral. The pathway is for those patients with concerning symptoms in whom you're concerned there is an underlying cancer. The patients who this pathway won't suit are those ones who have, albeit concerning and difficult symptoms, but that are long-standing and don't suggest a possible underlying cancer. What we don't want to do is to be part of a revolving door of extra investigations that don't support the patient and you in primary care effectively.